What I want to talk to you about is I want to talk to you about broken bones. I want to talk to you about osteoporosis, and I want to talk to you about the broken bone business and the way we deal with that, and the way I think you ought to deal with it. Because it isn't natural that people, in particular women, have their bones dissolve away when they're 40, 50, 60 years old, and yet they're supposed to live to be 85. How unfair for our Creator to put together such a design as a faulty female. In fact, there's a whole lecture I used to give which is entitled God Hates Women. But I don't give that anymore because I get into trouble every time I do. But the point being is that women fall apart very rapidly. And they don't seem to be very well put together. And some people do conclude that it's a faulty design. But of course, from my perspective, that's not it at all. From my perspective, the truth is that they just suffer terribly from the burden of the rich diet. And this is one aspect of that burden that I'd like to share with you and how to relieve it, how to keep those bones for a lifetime. The reason people lose bone is because of all the acid that they eat. We eat a very high acid diet, and that acid comes from animal foods. Now, the body must maintain its acid-base balance precisely. It's absolutely crucial. All the reactions in the body that take place depend upon that pH, or acid-base balance, being precise and not varying. And so it'll guard that balance to all extremes. And so if you pour acid into the system 3, 4, 5 times a day in terms of the food that you eat, your body has to do something with that acid. It has to neutralize it. And the primary buffering system of the body is the bones. So the acids in the food come from cheeses. As a matter of fact, hard cheeses is the most acidic food people eat. And Parmesan cheese is the most acidic of all the cheeses. Poultry, very acid. Meat, eggs, very acid. And so is seafood, whether it be lobster or fish, very acid. The alkaline part of the diet comes from fruits and vegetables. Now, your pH in your body, your acid-base balance is slightly alkaline. So the body tends towards being alkaline, and it wants to be in that condition. If you force a lot of acid on it, like we do in the rich American diet, what happens is you have to neutralize that acid. The bones dissolve, and they release alkaline materials. And that's the initiation of osteoporosis. And it continues as effects occur throughout the body and also in the kidneys. In the kidneys, that acid causes calcium to be lost. The kind of amino acids that are plentiful in meat prevent the tubular reabsorption of calcium back into the body, so the calcium is wasted. All that protein we eat, it creates something called a solute load, which makes the kidneys work harder and faster and pump more material through them and causes the bone material to be lost. And that bone material ends up in the kidney system, and it solidifies and it forms little tiny bones in the kidney system known as kidney stones. That's how you get kidney stones. Well over 95% of the stones that occur on the Western diet are based on calcium. If you look worldwide, you see this particular picture. You see that when you consume a high animal protein diet, country by country, you have greater bone loss, and that's represented here by hip fractures, which is the most serious manifestation of osteoporosis. It's a deadly problem, is hip fractures. So in countries where they eat a very low acid, very low animal protein diet, like in rural Africa or Papua New Guinea, hip fractures are virtually unknown. As you move up the animal consumption chain into places like Singapore and Hong Kong, where they eat a little bit more animal protein, they have a little more hip fractures. And if you move up into countries that are modern Western countries like the United States, New Zealand, Australia, Denmark, Sweden, where they consume a lot of animal protein, you have the highest rates of hip fractures. Let me show you another relationship that should make you question the common teaching. And that is when you look at the calcium consumption worldwide and you compare that to hip fractures, you see a similar relationship, and that is the more calcium consumed worldwide, the more hip fractures. Now, that must say something important to you, and that is the message from the dairy industry has to be false. At the very least, dairy products don't prevent osteoporosis because the highest consumers have the most hip fractures. And possibly dairy products contribute to osteoporosis, possibly. If you look at the experiments that were done primarily in the 70s and 80s, these are experiments where they took people, and each one of those initials up there represents the principal investigator in the study. They fed them various levels of calcium intake, and then they either put them on a low-protein diet or a high-protein diet. When they're on a low-protein diet, in each and every case, even when they were consuming very low amounts of calcium, like 500 milligrams a day, as long as they were on a low-protein diet, they were in positive calcium balance. That means more calcium stayed into the body than left through the feces and the urine, a positive balance. Now, when you're on a high-protein diet, you're in negative balance even when you're consuming very large amounts of calcium. The body cannot compensate for that high-protein, high-acid load that's delivered to it with the fork and spoon 3-4 times a day. So if you're going to keep those bones intact, your primary effort is to reverse the cause, which is that high-protein, high-acid load. There's an interesting study that was reported in National Geographic, a study of 2 women. They found these 2 women, they were buried in an ice floe. They were sitting in their hut 500 years ago, and an ice floe fell on top of them, and they were deep frozen for 5 centuries. And they found these 2 women, and they did an autopsy on these 2 women, and they found that they were somewhere in their 20s, one of them, and the other one was in her 40s. And in the autopsy, what they found is that these women showed severe signs of osteoporosis, and they also suffered from atherosclerosis. And the conclusion of the authors of this National Geographic article is that these women who lived 500 years ago got this bone loss and got this artery damage from eating a diet high in whale and sea blubber. So see, this is not a phenomenon just of modern times. Whenever throughout history people have depended upon a high-acid, high-animal protein diet, what happened is they developed problems of their bones and also problems of their arteries. The main culprit here as far as acid is concerned is the sulfur-containing amino acids. There are 20 amino acids, 2 of them contain sulfur. One of the most common ones is methionine. You see the sulfur represented here by the yellow atom. If you look at the sulfur content of the food, represented by methionine, what you find is for every 100 calories, pinto beans have 95 milligrams of methionine. Potatoes, only 35 milligrams. Rice, 52 milligrams. Egg whites, 700 milligrams of this very acidic methionine. Whole eggs, 250. Beef, chicken, salmon, somewhere between 250 and 350 milligrams of methionine. Now that sulfur-containing amino acid, it breaks down into sulfuric acid. And as a consequence, that sulfuric acid delivers a very powerful acid load to the body, which must be neutralized by the bones. Now there's a scale that is used in the scientific community. It's called relative acid load. And let me give you the contribution that various foods make to the acid load on your body. If you look at the relative acid load, eggs have a relative acid load of a positive 5.6, yolk 7. Beef 6.3, chicken 7.0, fish, health food fish 9.3, and cheddar cheese, as I mentioned, cheese is the highest acid load delivered to the body. Now look at the vegetable foods. On the minus side, it means alkaline. So potatoes are -5, peas are positive, they're +1. Wheat +1, bananas -6, apples -5, spinach -56. Of course, we don't eat spinach anymore, do we? No. That's not because spinach eats E. coli. It's because a cow delivered its E. coli onto the spinach plant. That kind of E. coli only comes from cows, by the way. Tomatoes are -18, so very alkaline. Now, you'll hear people say that you have to be careful of a vegetarian diet, particularly one of grains and beans, because it delivers an acid load and causes osteoporosis and kidney stones. Well, the acid load delivered is quite small. It's 1 as compared to 9 or 10. And people who eat a healthy diet like we recommend don't live on a diet just of grains and beans. We don't recommend it. You also eat lots of very alkaline vegetables. So as you make that minestrone soup, if you measure the pH balance, you'll find it's an alkaline soup, which contributes to healthier bones. But somebody who has a bone loss problem, I would ask them to be careful about not over-consuming too many legumes and too many grains. Now, the concern about meat has reached the attention of, guess who, the meat industry. And they're very concerned about vegetarians, and they're concerned that vegetarians are going to get their business. And so as a result, they have been putting together studies to help prove that meat is not as dangerous or equally as dangerous as eating a vegetarian diet. And so one of the studies that was recently done was supported by the North Dakota Beef Commission along with the United States Department of Agriculture. Now, how do those two get tied up, I wonder? Well, regardless, they got tied up, and they did a study where they took 25 milligrams of isolated soy protein. Now, I want you to remember that term, isolated soy protein. That's a soy protein that has been removed from the soybean, concentrated as basically crystalline soy protein. And they substituted that for 25 milligrams of meat protein for 7 weeks, and they found that soy was just as damaging as meat to the bones. And of course, they published this article, and they want people to know that you really don't have to be a vegetarian to preserve your bones, that soy is just as bad for you as is meat. Well, industry has put a lot of effort into trying to disprove what I just told you. And that is that eating all this meat isn't bad for you, this acid load isn't important. And so they design studies where they do something very important. Is what they do in their study design is they make sure all that acid is neutralized. And you can do that in 2 ways, and it's done in both ways, by the way. They will take and look for populations of people who eat, in addition to some meat, which is very acid, or cheese, which is very acid, they'll look for people who also eat a lot of alkaline foods, a lot of fruits and vegetables, so they neutralize that acid. Well, what they'll do is they'll set their experiment up in a laboratory situation where they will feed them a meal plan that may be slightly acidic, and then they'll give them antacids, like Citracal. And it'll neutralize the acid. So once you neutralize the acid in the diet, then you can see the bone-building effects of these animal foods. And this has been talked about so far today. Let's talk about how this occurs. What has been mentioned is the purpose of milk is to grow. In the case of a cow, milk grows a calf from 60 to 600 pounds. It's a very strong growth stimulating food, as it is supposed to be. And part of that growth stimulation involves a hormone called insulin-like growth hormone, insulin-like growth factor 1. Now, they call it insulin-like growth factor 1 because it looks almost just like insulin, and insulin itself is a powerful growth stimulant. But this is an even more powerful growth stimulant. It has a few molecules that are different than insulin. And so they call it insulin-like growth factor 1, and it causes the growth of tissues. Now, this is the new sales pitch for the dairy industry. They finally figured out how to explain to scientists, to doctors, and to lay people who are interested how dairy products cause bone growth when they're very acidic and they actually cause bone loss. So how do they cause bone growth? It's because of this hormone. This hormone is increased in the body, and it promotes growth of normal tissues like bones. But one of the things that they don't tell you about, which you really need to know about, is one of the hottest topics in cancer research is insulin-like growth factor 1. It promotes growth of abnormal tissues too, like cancer. But that never hits the advertising page of the dairy industry. So, insulin-like growth factor 1 is a very powerful hormone to stimulate growth. The dairy industry has paid for 2 studies, one in adolescent females and one in postmenopausal women, where they showed by adding milk to the diet of these females that they increased the amount of insulin-like growth factor 1 in their blood by 10%. There you go. It's vindicated. It works. You can raise insulin-like growth factor 1 by milk, no surprise. But what may be a surprise to you is there are other ways to raise insulin-like growth factor 1 that are even more powerful than milk. A study done recently where they took 40 grams, and I want you to remember that number, 40 grams of isolated soy protein and compared it to 40 grams of isolated cow protein. And they did an experiment where they measured the rise in insulin-like growth factor 1 in the blood of these subjects. These are people. And what they found is that you could double the increase compared to milk of insulin-like growth factor 1 by using soy. Isolated soy protein. Okay, remember that term. Isolated, that's crystalline soy protein that they put in all kinds of fake foods that people are eating these days who are particularly new vegetarians, don't understand the whole picture. So you have the positive consequences. I can imagine that soy protein might cause bone growth by stimulating insulin-like growth factor 1. Just like milk does. But I can also imagine it promotes cancer growth too, just like anything that raises insulin-like growth factor 1. Now, they did another experiment where they put people on a very low protein diet. So this is a diet that almost guarantees, in fact, guarantees that the people are going to be in positive calcium balance. This is 40 to 50 grams of protein a day. You have to get up around 80 to 90 grams of protein a day before you get into negative balance, where you're losing more calcium in your urine and feces than you can absorb through your gut. And they gave them a lot of calcium. They gave them 1,100 milligrams of calcium, so you know these people were in positive calcium balance. And then what they did for these subjects is they fed them 40 grams of isolated soy protein. And guess what? They all went in negative calcium balance. They had a negative calcium balance of 86 milligrams per 100 cc's of their urine. Another black spot on soy. But remember, I said isolated soy protein is what they're using to raise insulin-like growth factor 1 and also to cause this calcium loss. So these are the kinds of foods that we're talking about that get you in trouble with cancer promotion as well as with calcium loss. These are the fake foods that people are so excited about these days. Things that, by the way, throughout my transition in my diet, have been part of my diet on many occasions. And fortunately, over the last few years, I've gotten them out of my diet because I've realized that these are fake foods, these are synthetic foods. These foods have a serious negative impact on the body. There was a day when I loved the Smart Dogs, and I loved the ground sausages and all these fake-looking foods that looked like my favorite foods in the past. And I understand some of those are part of your diet, but I encourage you strongly to get them out of your diet. The candy bars. They sell you these candy bars, the idea that you need all this protein, and so you'll see labels on bars like the Cliff Builder bar that says you get 20 grams of isolated soy protein. You go, yay, this is wonderful. It's supposed to be a health benefit, but based on what I just told you, you could get into some real trouble. Remember I told you that 40 grams of isolated soy protein caused your insulin-like growth factor 1 levels to go up twice as much as milk? And 40 grams of isolated soy protein would put you in negative calcium balance even if you ate a very low protein diet, very high calcium diet to start out with? That's how powerful it is. Well, let's see how easy it is to get 40 grams of isolated soy protein. If you had 1 soy chicken patty for lunch and 2 soy burgers for dinner, you'd have that 40 grams of isolated soy protein. I used to do that. How about 1 soy candy bar and 1 soy shake? 40 grams of isolated soy protein. You're in negative calcium balance, and you've dramatically increased your insulin-like growth factor 1 levels. Oh, this used to be my favorite. I knew there was a problem with these sausages. I'd sit on my plate, and they have all this grease all over it, but they're really tasty. So I kept eating them. But 4 of these little Morningstar sausages, 40 grams of isolated soy protein. Not a good idea. So we have a situation here where eating these high-protein foods do 2 things that happen to be in opposite directions in terms of bone health. They increase insulin-like growth factor 1, which increases bone growth. But they also deliver a very high acid and protein load. So protein in general increases insulin-like growth factor 1. Soy protein is one of the, isolated soy protein is one of the strongest stimulants. Milk, meat, poultry, fish, shellfish, and also calcium loss. The overall net effect is that these foods, these high-protein foods, considering all their pluses and minuses, and I hope I haven't confused any of you because things don't act in a vacuum. There are many things that go on when you eat the foods, but if you add it all together, what the research says is that these high-protein foods, including the isolated soy protein foods, do promote cancer and do promote bone loss. And you say, well, McDougall, you've been recommending that we eat soy foods for all the time we've been listening to for the last 30 years. Yes and no. We have never recommended soy candy bars or Boca burgers or Morningstar sausages or shakes made of isolated soy protein. What we recommended is that you eat small amounts of traditional soy products in your foods, like maybe the Asian does, 2 ounces a day of tofu, soy milk, miso, tempeh. These foods that are made with very little processing that have all kinds of other positive ingredients in them. And my overall conclusion is that these foods are neutral. They're not miracle foods to encourage excellent health, which is taught by people who would like you to eat a lot of soy. And they're not harmful foods that cause all kinds of things from Alzheimer's disease to cancer, like people who are anti-soy will tell you. They're just foods. And I see no reason that most people can't include a small amount, say a couple ounces a day, of soy milk on their cereal, or a little bit of tofu as a condiment in their stir-fry vegetable dish. That's the way we've always taught it, and that's the way we'll continue to teach it. But that's different than eating all these fake foods that are so popular these days. So please understand the difference. All right, now you know how to prevent osteoporosis, and if you have weak bones, you know how to strengthen them. Let's change the subject a little bit. Let me talk to you about the broken bone business. Let's talk about the money-making part of the broken bone business, and the way that we make this money is we instill fear in the public, particularly the female segment of the population, so that we can create big business. This is done in a wide spectrum of the medical businesses, but I want to isolate right now my discussion to the broken bone business. There's a term I'd like to make you familiar with, and that term is an official medical term. It's called disease mongering. And a guy named Monahan, he's made this very popular in many of our medical journals. Disease mongering is the selling of sickness that widens the boundaries of illness and grows the market for those who sell and deliver treatments. That's what Monahan says. It is exemplified most explicitly by many pharmaceutical industries who fund disease awareness campaigns. Disease mongering turns healthy people into patients. That is the goal. And that is what is practiced throughout the medical business. Like it would be in any business, if you're in the auto industry. Whatever business you're in, you want to get customers. So how do you get customers? Well, you do it by disease mongering. The first step in disease mongering is to define a disease so you include a lot of people. So you can make almost everybody sick, and then you've got this great population to sell to. And the way you do that with osteoporosis or thin bones is you do it with a test called the bone mineral density test. And you take a wide swath of the population. Bone mineral density tests. The bone mineral density test was a definition that was set up by the World Health Organization in a set of meetings that were sponsored by 3 pharmaceutical companies. And they decided that a normal bone mineral density would be that of a woman at her peak bone mass who is approximately 28 years old in her reproductive years. Now, why do you think a woman 28 years old would need to have a large bone mass? Her purpose, her biologic purpose is to conceive and grow and nurse a baby. She needs these tremendous calcium stores, right? So she needs this big bone mass. Now, as you get to be 50 or 60 or 70, it doesn't make a lot of sense to carry around a bone mass that you needed to reproduce, does it? And why would nature be so uneconomical? The bone mass naturally and normally decreases as you go through life. It's supposed to. But that's not the definition. The definition is if you don't meet the criteria of a woman in her peak reproductive years as far as bone mass, then you are sick. And so the World Health Organization has set up some standards. And this is based on how far you deviate from this ideal woman. 1 standard deviation, you're normal. 2, you are between 1 and 2.5 standard deviations, you have a disease worthy of testing and treatment called osteopenia. And if you get 2.5 or more standard deviations away, you have osteoporosis. And if you break a bone and have this deviation, you have severe osteoporosis. So how many women are sick? Well, you take a look at British Columbia, a big study done in 1995. They looked at a population they estimated to be 813,000 women over the age of 40, and they found 536,000 of them were sick. Had osteoporosis or osteopenia. Two-thirds of women living in Western countries are sick and deserve testing and treatment. What a business. The first step to disease mongering is complete. We have identified a huge population to sell tests and treatments to. Other studies have showed similar. Study shows 44% of participants under the age of 65 are sick, and 70% older than 65 are sick with osteopenia and osteoporosis. based upon not having a bone mineral density ideal compared to a woman in her peak reproductive years. Even the World Health Organization, they said 30% of all women over 50 have the severe form of bone loss, osteoporosis. All right, so you've got the population, you've got them identified. Now you've got to go get them. And this is the second step in disease monitoring, is you go out and you find these people. Well, the way they do it with the osteoporosis business is they give free testing equipment to doctors so that they can test you in the offices. They set up screening programs in shopping centers. It's your place of work and health fairs. And you think, oh, this is all so benevolent. For my best interest, they're going to give me a free bone mineral density test. Who do you think sponsors those? It's those who sell the tests and treatments who sponsor them. So that's the second step in disease monitoring. A recent review, an honest review of the situations goes like this. A recent analysis of 7 separate study populations of over 2,000 fractures found that bone mineral density cannot identify individuals who will have a fracture. And they go on to say, we do not recommend a program of screening menopausal women for osteoporosis by bone mineral density testing. Yeah. Well, let me tell you, we like to predict and you like to know what your future is all about. And bone mineral density has some relevance. It has some relevance, but how accurate is it predicting what's going to happen to you? Not very. In fact, there are lots of things that I can find out about you that would better predict your future in terms of strong bones and risk of fracture than bone mineral density. These are like your age. If I knew your age, I could better predict your chance of having a fracture. If you had a close relative who had a fracture, I could better predict than with bone mineral density your future as far as bone strength and health. If I just considered your overall health, that would be a better way of predicting whether you're going to have a fracture than bone mineral density. But the problem is I can't charge you for asking your age or your family history. So even though these are more accurate at predicting your future risk of bone health, they are discounted because they don't fit into the disease monitoring program process. All right, let me tell you what the issue is here. Here's a comparison of healthy bone, which you see on your left, this bone over here, and you see that it has a tissue to it. I want you to think about bone for a minute. I mean, I have to resort to this, but think about a chicken bone. When you last ate, and hopefully it was a long time ago, a chicken, and you had the bone, and you took that bone and you bent it, it was very strong tissue, wasn't it? Yeah. And nothing rigid like a piece of chalk that's full of calcium, was it? No, bone is made of tissue. It is made of a structural material, of proteins, carbohydrates, vitamins, and minerals that make this tissue. And that's where the strength comes from. And so you see a lot of tissue in the picture on your left. And by the way, within that tissue sits calcium, incidentally. The strength doesn't come from the calcium. The strength comes from the tissue. If you have more tissue, you have more places for the calcium to sit. And so therefore, you may have a stronger or higher bone mineral density. As you pour acid on your bones with your meals 3-4 times a day, decade after decade, what happens is you destroy the tissue. It is dissolved. It is damaged. And the tissue, it disappears. And so you have big holes in the tissue. Pardon the analogy, like Swiss cheese. And there are less places for the calcium to sit. But the problem is the missing tissue. It's not the calcium in the bones. You want to look at bone mineral density. I'll show you some bone mineral density. Look at these bones right here. These bones are beautiful. They look like porcelain. Let me tell you how those bones were created. Those bones were created by feeding fluoride to people, which 40 years ago they used to do in an attempt to strengthen the bones, but they never do that now. Why? Because fluoride, even though it makes the bones very dense looking, causes the tissue to become very brittle and dramatically increases the risk of fracture. So you compare this case of fluorosis with normal bone density that you see in this x-ray, you see a dramatic difference. But you don't want bones that look like this. They may be pretty, but they're fragile. They'll break it like a china plate. All right. I'm gonna sell you something here, okay? I'm going to sell you the car that's in this package. That's a big package, by the way. I'm going to sell you, there's a car in this package, and I'm going to give you 90% off this car. But unfortunately, it's at my house, which is 10 miles away, so you got to walk there and get it. Would you like to buy it? Yeah, you want it 90% off. Hey, man, it's a deal. Oh, you forgot to ask what the value of the car was. Okay. Let's do it again. I'm going to give you 95% off the car that's in this package. You got to walk 10 miles to get it. You want it? No? When do you start walking? You see, you never ask what the original value was. What's 95% off? I go to Reno and Las Vegas, I gamble. I put my chips down, but they're dollar chips. The guy next to me is putting $500,000 chips down. We both lose all our money. Who has the biggest frown on our face? You know, chips are the same size, but they have different value. You must know what the original value is first to determine whether or not a reduction of 95% or 50% or so on is worth your trouble. All right, let's take about some of these bone mineral density treatments that we have out there. Let's take, for example, Fosamax, which is very popular now. It's popular because estrogens aren't popular right now. They will be again soon, but they're not popular right now because the HERS study came out about 4 years ago that said if you're going to take hormone replacement therapy, you're going to dramatically increase your risk of breast cancer, uterine cancer. You won't protect yourself from Alzheimer's. You won't protect yourself from heart disease. And so it's a bad buy. And so on the front page of every newspaper, women were told, go to your doctor and get off these hormones. And so hormone replacement therapy virtually disappeared. But that's all changing. It's big business. It's coming back to you now. The marketers are out there to try and get you convinced to start it again. So as a result, what we're going to sell women to help them with their bones? Well, there are these drugs like Fosamax and Actonel that are now sold to women to increase their bone mineral density. And so you go to the doctor tells you, hey, Fosamax will cut your risk of having a fracture in half. You go, I'd be stupid not to take that drug. Okay? Well, let's take a look at one of the major studies. This is on fracture of the spines, and I'm not distorting the literature here for you. You can go and look at other studies. They all basically show the same thing, but here's an example. If they look at a study where women took Fosamax for 4 years, now this is a very potent drug, not only just costly, but there was the instructions are for you not to lay down for half an hour after taking it because it causes such severe gastrointestinal distress. So you look at the research done, and what you find in the studies of women who take this drug for 4 years now is at the end of 4 years, those who are in the placebo group had a 3.8% chance of having a spine fracture. Those who were in the Fosamax group had a 2.1% chance of having a fracture. And you look at those percentages, you go, wait, what's going on here? You told me it cut my risk of fracture in half. Yeah, it will. Relatively, it'll cut it basically in half. In other words, if you do the math, you take and divide 2.1 by 3.8, you get 0.56, subtract that from 100%, and that's a 44% reduction. That's the relative benefit. Just like those cars I showed you. You didn't ask what the absolute benefit is. The relative reduction is about half. But the absolute reduction is 1.7%. And so the doctor tells you, look, you got to take a drug that you have to sit up a half an hour after you take it, that reduces your risk of fracture by less than 2% in 4 years. In fact, you have to treat 235 women to get one less fracture a year with this medication. This is expensive stuff, too. And it has some other serious side effects that are becoming so well known that they consider Fosamax the new Vioxx. The lawyers are so excited now because they're running out of lawsuits for Vioxx. And so they're going after these biphosphonate drugs because of the adverse effects they cause. They cause severe bone and joint and muscle pain. I've seen women who have been bedridden who are on these medications. Now, the way these drugs work is they stop bone turnover. Well, part of bone turnover is bone growth. And so if you're on this medication and you break your bones, it stops bone turnover, so they can't regrow also. And so you have delayed fracture healing. Sometimes the fractures don't heal for a couple of years. Now, I showed you that at 4 years, which is the data that the drug companies presented to the FDA, you reduce the risk of fracture by 1.7%, the absolute reduction. But how about if you carry it out longer? I mean, you're going to be taking this for more than 4 years. You're certainly going to live longer than 4 years. Unfortunately, the long-term results that are reported, in other words, 7 years, the net result is that you end up having more fractures if you're on this drug. And then another interesting set of reports, and the one that the lawyers are so excited about, is the fact that this drug prevents bone turnover so severely that you get necrotic you get necrotic sores in your bones, pieces of bone die. In fact, there are many oral surgeons who will not take a patient who's on Fosamax. In fact, a good share of them won't because of the problem with jaws and bones and healing and so on. Okay. So let's talk about hormone replacement therapy for a minute. It used to be popular. It's going to be a lot more popular. Doctors will tell you that hormone replacement therapy cuts the risk of osteoporosis by about a third. Well, I'd be foolish not to take hormone replacement therapy, right? All right. Well, let's take a look at this. Is a JAMA article in 2004. Again, this is not a distortion of the scientific literature. You can go look at other articles. They basically show the same thing. Take a look at the risk of hip fracture over a period of almost 3 years. For women, say, between the ages of 50 and 54, and many, many women out here, even in this audience, are being treated with therapies, drug therapies, to prevent bone loss at this age. If you're between the age of 50 and 54, you have no treatment, then you have a risk of 4 in 10,000 over 3 years of having a hip fracture. If you have hormone replacement therapy as a treatment, your risk decreases to 2.5 fractures in 10,000 women over almost 3 years. In other words, you have a absolute risk reduction of 1.5 fractures in 10,000 women over 3 years. Are you sold? All right. What that means, if you take and divide everything out, is you have to treat approximately 19,000 women for a year to prevent 1 fracture. Puts it in a whole other perspective, doesn't it? How about women at a high-risk group? How about women between 65 and 69? 24 fractures in 10,000 women, 3 years, no treatment. 15 fractures in 10,000 women with treatment, hormone replacement therapy. That's a 9 fracture reduction in 10,000 women over 3 years. In other words, you would have to treat 3,100 women for a year to prevent 1 fracture. Do you understand the difference? You need to know what the absolute benefit is to you, not the relative reduction in risk. It's extremely important. It's not just with drugs to treat osteoporosis. It's all the medical therapies out there. Let's take a look at high blood pressure for a minute. Medications cut the risk of stroke in half. I'd be stupid not to take high blood pressure pills. Don't you think that? I know 20% of you in this room are on blood pressure medications. You'd be foolish not to take blood pressure medications with this kind of a sales pitch, wouldn't you? Well, let's take a look at one of the studies. This is out of the British Medical Journal. Risk of stroke for 5 years. 15 chances in every 1,000 untreated patients. With medication, the risk is 9 strokes in every 1,000 patients over 5 years. Okay, so the relative risk reduction is 40%. Nearly cuts your risk of stroke in half. But the absolute risk reduction is 6 strokes per 1,000 people over 5 years. In other words, 1 less stroke per year treating 1,000 people with medication. Now, does that make you feel good about not getting an erection by taking these medications? I don't think so. You must understand what's going on. This is very important so you can make the proper decisions. You are being lied to by the pharmaceutical industry and knowing or unknowingly by your medical providers. And this is not right. Okay, so who's recommending bone mineral density tests? Some very highfalutin sounding organizations are. Like, for example, the International Osteoporosis Foundation. They say you've got to get this test. Bone mineral density measurements are effective in assessing fracture risk, confirming a diagnosis of osteoporosis, and monitoring the effective treatment. And so, similar statements come out of the U.S. National Osteoporosis Foundation and the Osteoporosis Society of Canada. Boy, this kind of an organization to tell me that I should get a bone mineral density test, how would I ever question these people? They are so official. So legitimate sounding. Well, let's take a look at their corporate board of advisors and their sponsors and see what they're all about. These are the people who put these organizations together, like Merck, Sharp and Dohme, and Procter & Gamble, and Pfizer, and Roche, and SmithKline. These are fronts for industry. They're out there to sell you drugs, and one of the ways they do it is they put together these foundations. All right, let's take a look at some organizations that don't have any such financial ties. Let's take a look at the Office of Technological Assessment of the University of British Columbia. They say research evidence does not support either whole population or selective bone mineral density testing of well women or at or near menopause as a means to predict future fractures. They say don't do it. How about the Canadian Task Force of Periodic Health Examinations? They say widespread bone mineral density screening is inadvisable at present. How about the U.S. Preventative Services Task Force? They say there is insufficient evidence to recommend for or against routine screening for osteoporosis with bone mineral density in postmenopausal women. Well, let's go to Britain. In the United Kingdom, the Effective Healthcare Bulletin says, given the current evidence, it would be inadvisable to establish a routine population-based bone screening program for menopausal women with the aim of preventing fractures. Some pretty different messages, but of course these messages don't have the financial power behind them that the other messages have to reach you. But this is what the truth is. All right, so my recommendation, just like these organizations I showed you, is do not get a bone mineral density test because you have a 2/3 chance of being declared sick. And the treatments are horrible. Now, if you need more motivation to follow a healthy diet, maybe you should get this test. But I think you already have enough motivation. Don't get this test. Now, what if you've already gotten the test? What if you have an old abnormal bone mineral density test that you're living with? You're frightened. They've gotten to you. You're in the business now. Well, the first thing I would tell you is to delay accepting drug therapy. And then get on a good diet, an exercise program, repeat your bone mineral density test in 2 or 3 years. You know, most of the women who carry this diagnosis and are told to be on these medications, they're young women. They're 40s and 50s and 60s. This is a disease of women much older in their 70s, 80s, and 90s. You've got time to think this out. And based on my knowledge, my experience, is you can reverse this disease. This is a tissue that will rebuild. This is bone. This is living. You send astronauts up to a space lab and they spend several months there. They come back and their bone mineral densities are decreased. You have them walk around for a while and their bones get thicker and stronger. You get a fracture. You may have had this experience with yourself or a child. You put the child in a cast and 3 months later you come back in and have an x-ray done. The doctor says, look how thin those bones look. Well, why not? You don't need all that material in that inactive arm. So the body makes appropriate adjustments. But you take that arm out of the cast, start moving around for a little while, what happens? It gets just as thick and strong as the other bone material. This is tissue. This heals. Stop the cause. Stop pouring that acid all over your bones. Eat an alkaline diet, a diet of fruits and vegetables, and go for a walk. Your bones will last you a lifetime. That's what's intended. Not to dissolve, disappear when you're in 40s or in your 50s. This is a disease from doing something unnatural. Which brings me to a general point that I'd like to close with. And that is, you're not going to win in the medical business. Just like with the angiograms that I talked to you about, the heart surgeries, the high blood pressure pills treatments, the diabetic treatments, you're not going to win. This is an extremely well-financed business. I encourage you, and the purpose of my work is to get you out of the business. Sick people take drugs, healthy people don't. Sick people spend their time in the operating room, healthy people don't. You don't want to be a treated patient. You want to be a healthy person. And the only way to safely get away from my colleagues and the pharmaceutical industry is to be healthy. And the only way to be healthy is to obey the basic rules, which are to breathe clean air, clean water, and clean food. And then you'll end up being able to enjoy your life, spend time with your family, your computer. You won't spend your afternoons sitting in the doctor's waiting room or sitting worrying about what time it is to take your next pill or what part of your body is going to fall apart next. That's not how you want to spend your life. You want to spend your life divorced from these businesses. And you can do that. Even if you're in trouble now, you can do that. You can get your health back. It's just basically a matter of learning the right rules and following them. And that's why you all came here this weekend, to emphasize those rules, to get the kind of life that you deserve. Thank you very much.